Hello, I'm Rajeshri Gadgil, founder of TRUWELLTH Integrative Healthcare and a celebrity nutritionist providing integrative and personalized nutrition therapy at multiple centers in Mumbai and Pune and to patients across the globe. This World Diabetes Day, I would like to highlight this year's WHO theme of diabetes across life stages and make a powerful call to you all to demand for integrative and personalized care, which can include timely screening, precise medical therapy, customized nutrition and exercise prescription with effective stress management and preventive care. While fueling the diabetes care, let's understand that nutrition and nutraceuticals are not fads. They can be an effective co-therapy when taken with expert advice. Its personalized use can fill nutrition gaps, preserve muscle mass, improve gut-pancreas health, and amplify the effectiveness of newer diabetes drugs. Stop chasing restrictive diets. Lasting diabetes control and remission requires consistency, making your food and supplements an ally at every life stage. We've gathered the nation's top doctors to decode everything from screening secrets to integrative treatments, remission reality, and managing complications to help you gain insights in managing your diabetes and its complications. Don't miss listening to this video till the end.
Hello everyone. On the occasion of the World Diabetes Day, I wish to congratulate Ms. Rajeshri Gadgil and TRUWELLTH Health TV for bringing out important awareness messages about diabetes and related disorders and their prevention. Today, diabetes has become a huge public health problem. We have more than 100 million people with diabetes in India. Obesity is also increasing very rapidly, not just among the rich people, but also among the lower socioeconomic classes as well. Luckily for us, advances in medicine are also improving simultaneously. Today, we have drugs which not only control your diabetes, but also bring down your weight. In fact, the weight reduction is very significant, and with that, your heart function improves, your kidney function improves, heart failure is prevented, and in short, you can even reverse diabetes. So, on this occasion of the World Diabetes Day, my message to everyone with diabetes or pre-diabetes or to anyone who has somebody in your family who has diabetes is that diabetes is not a disease, it is a simple disorder, and if you keep it under control and if you follow the ABC, keep your A1C 3 months control under good control, your diabetes. Second is your blood pressure, that's B, and C is your cholesterol. And D, of course, stands for a little bit of discipline, diet, exercise, stress reduction. If you just do these simple things, we can hope that we will have a diabetes complications free India. So let me wish Ms. Rajeshri Gadgil and all the viewers a very happy World Diabetes Day. Thank you.
I am Dr. Vimal Pahuja. I'm a consultant metabolic physicians at Dr. Illich Hiranandani Hospital, Powai. Diabetes is not just about the blood sugars. It's about living in a complete well-being, emotionally, physically, taking charge of your health, getting adequate sleep, getting adequate rest, stress, moving more, being physically active, and managing your diabetes holistically rather than just the blood sugar control. This Diabetes Day, this is a theme, diabetes and well-being, which teaches you that blood sugar control is not enough. You have to live with the diabetes in a very holistic way, in a very calm way, and accepting the diabetes and moving in with gracefully. Diabetes is not about blood sugar control, and if you look at these sugars, uncontrolled blood sugars, and not looking at the other problems of complications can lead to a lot of problems. Diabetes causes many complications, namely microvascular, that means you get heart attack, you get strokes, you get poor circulation in your legs, and you can have leg pains and you can have amputations. You can also have a microvascular complications like you can have retinopathy causing blindness, you can have a kidney problem, nephropathy. All these complications take a toll on patient's life, and controlling diabetes and spending on medications is much less than what you spend on complications and getting hospitalized. So take charge of your diabetes, take charge of your health, and live well in a complete well-being with diabetes. Thank you.
Hi, my name is Dr. Anjana and I'm from Dr. Mohan's Diabetes Specialty Center. The question we're asking today is diabetes reversible? Well, the first thing to note is the term reversal is not completely accurate. So the correct term that you would use is remission of diabetes. Now, is this possible? Yes, it's possible in some people, but not all. So that's very important. There's a lot of misinformation about this. There's a lot out there. So let's look at this in a little more detail. There's lots of types of diabetes. Not all diabetes is the same. Some are related to insulin secretion, some to body fat. So there are some types of diabetes that are reversible. If you have younger age of onset with less duration, yes, it can be done. But make sure that if you want to reverse diabetes, you do it in a scientific way. Contact a doctor or a qualified nutritionist so that you can have remission of diabetes in a healthy manner.
Hello friends, I'm Dr. Alpana Sovani, a metabolic physician and a diabetes specialist from Mumbai. I practice at Diabetes Specialty Center in Bombay. I'm also attached to Fortis Hospital. I'm going to be talking about the importance of exercise and diabetes. We know that people living with diabetes, they have a fixed protocol in terms of what they are allowed to eat and what they should eat. Plus they need to take drugs, whether it is oral or insulin. But exercise remains as one of the mainstay of management of diabetes. So how do we start an exercise program? There are a few pointers that we need to address before you start exercise. Let's say you have a neighbor who's the same age as you, and if he runs marathons, just because you decide to start exercising today, you don't start at the same level. Always start an exercise program depending on what your existing fitness levels are. If you are someone who's never exercised before this, then make sure you have a doctor who can help you, track your exercise schedule. Start small, build on it, be adherent to the exercise, and at the same time be a little kind to yourself. You don't need to exercise 7 days a week. You don't need to exercise if you're not feeling well. But consistency is something which is very important while you take up an exercise program. Something as simple as a 20-minute walk twice a day, or maybe if you don't have that level of fitness, maybe 10 minutes 3 times a day after each major meal works to start it off. And as your fitness levels increase, you can keep building on this level of exercise till you reach around 30 to 45 minutes of physical activity daily. There isn't any fixed time or good time for exercise. Whatever works for your schedule is a good thing. Another thing which I always counsel people with diabetes is please pick up something which you enjoy. It does not have to be only walking or running, or it could be cycling, it could be swimming, it could be dancing. Please choose something that you would enjoy. It should not become a punishment. Exercise should be enjoyable. Only then will you persist with it for a longer time. We are seeing younger and younger patients today with diabetes, and they have a whole lot, they really have a tough schedule to fulfill, and removing an hour for exercise may be difficult. I generally tell my young diabetic patients that, make sure that you can make it a part of your everyday work life. Maybe get off one station earlier, or if you travel by car, ask a driver to leave you a little, 20-25 minute distance away. Take stairs more often. When you're on business calls, you can, just keep pacing around your room. Climb a few stairs during your lunch break. There are many ways to accomplish our goals for exercise if you really want to. So every time you take up an exercise pattern, make sure you're starting small, building up, and stay adherent to it. Always make sure that once you have achieved a certain level of fitness, you do add some amount of resistance training to it. It could be in the gym, it could be at home, you could start with TheraBands, but resistance training is always going to help increase your overall outcome which you get with exercising. I cannot emphasize enough the role of adequate protein in your diet. So whenever you are starting an exercise plan, please make sure you are adhering to all these factors. So stay happy, stay healthy, and wishing you all a very healthy life on this World Diabetes Day. Thank you.
Hi, I'm Dr. Prashant Salvi, robotic, laparoscopic and bariatric surgeon at Jupiter Hospital, Thane. 77 million Indians were diabetic by the end of 2019, and it has been shown to rise to 134 million by the end of 2045. And surprisingly, 57% of individuals remain undiagnosed for diabetes. Diabetes is the 9th leading cause of death globally, and India is termed as the diabetes capital of the world. 90% of the time, type 2 diabetes can be related to overweight and obesity. So on this World Obesity Day, let's make people aware, spread the awareness about obesity, spread the awareness about diabetes, and we still have a lot of options to control your sugars, to control your weight by the help of good nutrition, a lifestyle modification, and a good amount of weight loss. Now sometimes obesity, diabetes together, we call it as diabesity. It can be treated, and once you lose your weight, you can also have good control over diabetes, and they have seen remission of diabetes after bariatric surgery as well. So a lot of options. Spread the awareness. Make sure that you are aware of your blood sugars on a periodic interval. If your weight is on a higher side, check your sugars periodically, and if you are diabetic and your weight is on a higher side, make sure to meet us, and we would come to a great solution for you wherein your weight also would be controlled and you will also have remission of diabetes. Thank you.
Hello everyone, this is Dr. Neha Sohoni. I'm a consultant obstetrician and gynecologist practicing at Kaushalya Medical Foundation Trust Hospital in Thane. On the occasion of World Diabetes Day, I would like to emphasize on the growing number of gestational diabetes, that is diabetes during pregnancy cases which we encounter in our practice. The major risk factors for GDM are elderly primary, there is pre-pregnancy obesity, PCOS, family history of diabetes, or diabetes in first pregnancy. The majority of these patients do not have any specific symptoms related to diabetes during pregnancy, and hence it becomes all the more important that you monitor your blood glucose levels on a regular basis. Generally, your gynac will recommend an oral glucose tolerance test around 24 to 28 weeks. It is important to keep your sugar level in check during pregnancy because uncontrolled gestational diabetes can lead to increase in the baby weight. It can lead to large or big babies. It can lead to increased liquor, which can lead to preterm delivery. It can lead to low blood sugar in the babies. Now, GDM can be effectively managed in these cases with dietary changes. Majority of the time, I tell the patient to consult a dietitian or a nutritionist so that they get their personalized meal plan. But the key is just simple. You have to stick to low carb meals, small frequent meals, cut down on sugar, cut down on processed food. Okay, focus more on simple home cooked food. Second is exercise. Make sure that your patient is doing at least 30 minutes of exercise. Even walking is good enough. And in spite of diet and exercise changes, if the glucose levels are still not coming down, then your doctor may recommend that you take some medications or insulin. Okay? It is important to remember that this condition is almost completely reversible in majority of the cases postpartum. So be informed, do regular checkups and glucose monitoring, and follow a healthy lifestyle.